I'd just like to again highlight that there is a real sense of urgency. The strategic planning process that we undertook was an aggressive process completed in a number of weeks as opposed to a number of months. But that was by design because of this sense of urgency that we all have, that certainly is shared by President Woodard and all the commissioners as we see this terrific alignment that has taken place from among our governmental leadership, from all the partner organizations within the district, within a sector that is critically important and one that is booming as part of our overall strength of our economy, one that is facing a great deal of change as well as some degree of certainty with the Affordable Care Act. And then just within the vocational assets that we have. With that kind of alignment, we realized we needed to act quickly, and even though we've been here a year, it has been a quick year. We had to go through those steps that the President outlined, but we really view this as a new day, the beginning of a new era for the Illinois Medical District in Chicago, and one that if we are successful will establish the Illinois Medical District as a leader, as our vision statement states, and patient care and medical research. But again, as we look to development opportunities, we will be guided by those 4 pillars, and it'll be through the lens of those 4 themes that we will judge the strength of projects and initiatives to continue to move the Illinois Medical District forward in this century. Under the infrastructure and real estate development, frankly, we've talked about several of the accomplishments already. They do include the lease of the second floor of this building to the Jesse Brown Veterans Administration Hospital, which opened up critically needed space within their hospital for clinical care for the veterans that they serve, whom have served us exceedingly well over the many years. It also includes the request for proposal. We knew that we needed to do parallel paths with master land use planning. We're putting together a team of all our partners to continue the master plans and to make sure that our land use development is consistent with that of the 4 institutions. But at the same time, we knew we had to get started. All of the partners suggested in the interviews that the mixed-use development of 2020 West Ogden was really needed and essential to bring the type of amenities to the medical district, to the 25,000 people that work here, to the 50,000 people that come in here on a daily basis seeking care. So we have issued a proposal that calls for development, mixed-use development, including a hotel that would include food establishments, that would include retail, that would include parking, that would include convention and meeting space, that will include potentially housing opportunities as well. We have challenged developers to be creative, to put forth creative proposals that also have green space, that are sustainable, and really add to the sense of community that all of us want to see the Illinois Medical District become. We also talked a little bit about the Anatomical Gift Association lease. It was critically important in our minds to bring that institution back into the Medical District. For those of you that don't know, they provide cadavers to the hospitals and research institutions across the Chicago metropolitan area, provide as a leading entity for advanced anatomical biosciences research, for first responder training, and we really see them as being an anchor in the southwest part of the district around areas of training, as well as in areas of emergency response and disaster preparedness. It's another clear theme that we heard in the infrastructure and development, that given the assets of the medical district, its location, its accessibility by any number of means of transportation modes, that the district should be a central focal point for emergency response and disaster preparedness training. We've talked with officials from the city, which is one's with us here today, Seth McKinney, Mike Masters with the county, IEMA Director Jonathan Munkin, FEMA Region 5 Director Andrew Velasquez, as well as federal officials, about the need and to identify the gaps in first responder training and the potential to develop training facilities here in the medical district to realize the potential that we have. Again, working in close partnership with the hospitals that we have and their fabulous emergency departments. As Michelle aptly noted, and frankly it was somewhat of an eye-opener to me when I came in, that the success of the medical district is going to be much more than just a play on real estate development. We really need to be that leading entity that works with the 4 major medical hospitals and the 2 major medical research centers, the 10 health science colleges, as to be a convener, to be the facilitator, to carry forth programs that collectively make the district a much stronger institution than any single one of those institutions can be on their own. As President Woodard pointed out, that it truly is the underlying mission of the Illinois Medical District as established in the legislation in 1941. So we realize that we need to focus on these components around community health, around translational research, and around clinical data. And I'm very pleased to say we have initiatives and projects going in each of those areas. In community health, one of the first things that we did was to work with the Stroger Cook County Hospital to make space available to them to do processing of Medicaid applications that they have been able to begin entering into as a result of the waiver that they were granted under the Affordable Care Act. That was a critical component for their success in implementing that initiative. It's also critically important to their overall financial success going forward. We will continue to work with the hospital in recruitment of new Medicaid clientele, helping them achieve their numbers with the bottom line of providing health care, insured health care to individuals that heretofore have been uninsured. If that's not consistent with our mission, I don't know what is. We've also been able to work back on the emergency response side to create or help create and really facilitate an Illinois Medical District Hospital Emergency Preparedness Coalition. The emergency departments have come together. They are unifying. We want to help expand their efforts, as I alluded to earlier, and very pleased that